Welcome. Happy Friday, everyone. This is the second Friday of the month, but it's still Friday. And so we know that it's time for Ask the Dietitian. And we picked a great topic to start off this year. Thank you for joining us. If you're joining us live on Facebook, welcome. My name's Lori Bumbaco. I'm an oncology dietitian. I'm presenting at Cancer Wellness Center. I work here and I meet with individuals one-on-one. So if you're interested in a consult, you can just check out our website and see if you're eligible. And then I also provide programs like this one. There's some great stuff on the calendar to be on the lookout for. And then I also co-facilitate a couple groups. So if you're interested, all you got to do is reach out. Our website's full of information, but we can link you with people to kind of walk you through the steps of getting your foot in the door and getting some services here. Our topic for this month happens to be a pretty popular one. So I have 47 slides to present. So I'm going to do my best to try to get it all done today so that we don't have to have a part two, but there is a chance that that will happen. If you have ever wanted to watch any of the programs we've offered here in the past, there's good news. You can do that. You just go to our YouTube channel. We record many of our programs just like this one today. So without further ado, what I'm going to do is share my screen. When you register for my programs, you have access to these materials, so the PowerPoint presentation, and then I also include recipes. So if that's kind of up your alley, then I encourage you to register for this program so you can get access to that. Thank you again so much for sharing. I'm going to share my screen and Lisa will just troubleshoot if there's anything that seems a little funky about my presentation and the technology. So thank you again so much. I promise this was a popular topic, and nutrition and immunity, I think this time of year is. And as it relates to even cancer survivorship. So there's a little bit more to talk about that. I share this image on the first slide because I think sometimes we get this information online, on social media, from just talking to people about these like immune boosting and immune supporting foods. And I'm going to sort of like set the record straight on what that really means and how we can help support ourselves with the foods that we eat to support our immune function. And it also happens to sort of overlap with how we can eat in a way to protect ourselves from cancer. So on the agenda today, hang on, I'm just getting the slides to advance for me. There we go. So on the agenda, I'm going to list those questions that were submitted and give the best answers that I possibly can, and then provide some additional resources and recipes. Now, there's some questions that I can't answer today because we really want to stick to the topic. As much as I would love to spend all day long answering your great questions that you submit, we really have to stick to the topic, which is really just focusing on immunity and how nutrition and food impact our immune function. So I'm just going to list the ones that were submitted and not related to our topic specifically. Are there foods that can lower elevated cortisol levels due to stress? I think we have an upcoming Ask the Dietitian, so we might roll that question over related to this. Can you tell us which dishes and pots are safe to cook with? Sorry for the misspelling there. Any foods really help to thwart cancer? Oh, there's so many, but you need to know based on your own unique and specific situation. So that's where you want to work with a dietitian like me. So ask to see me here. What holistic therapies are available and safe while going through chemotherapy and radiation? All really good questions. Do you have any easy and healthy to make recipes for lunch, dinner that can use common ingredients? We just so happen to have a great program on the calendar. It's at the end of the month. It's the last Monday of the month. It starts at 1 o'clock and it's all about meal planning. So I'm going to sort of integrate this type of question for that program. So you can get that question answered. All you got to do is sign up for that program. And then should we be counting our macros? I did formally during 2024 do an Ask the Dietitian all about macronutrients. So if you check out the YouTube channel, that question hopefully will answer that question can be answered. Okay, so we're going to get to those questions that were related to our topic, and I thought it most appropriate to start with this one. How is immunity influenced by food? What a great question. So what role does food have in our immune function? It's really important that I do make this clear, that as we age, there's a significant decline in our immune function. I'm not a specialist, I'm not a physician, so I can't really explain that more elaborately than this, but I share that because food is something that is definitely empowering, but it only takes us so far. it's only one piece of the puzzle, right? So I don't want to give you really like false information or give you these high hopes that if you eat a certain way, it's absolutely going to optimize your immune function when there's some other things that we're competing against, right? So sometimes there's things that are not in our control. We still want to really maximize how well we're doing with all of the things that are in our control. And that's how we can help protect ourselves best. Now, certain cancers and cancer treatments impair the immune system as well. So similarly to aging, there's only so much we can do about that, right? And that's why when you work with your oncology team, they'll share with you what is necessary for you to do in order to really support yourself because of the impact on cancer and treatments. Again, food is only going to do so much for us. Okay. Now here's what I want to make clear, and I'm going to share this a couple times throughout the presentation. Food provides us with adequate amounts in sufficient concentrations to support our immune system. So that's the bottom line. That's it. That's all we need. We need to make sure we're eating enough of those nutrients that we know are linked with helping our immune system do its job the best. Just like really all the other cells in our body. Like if we think of muscle, that's a really good example. Just having enough protein is what it requires, right? So that our muscle health and function can do its job and do the best job possible. It's not like we want to overdo it, right? Because that doesn't necessarily mean the muscles are going to work better if we over consume protein, right? So hopefully I'm making that point pretty clear. Each stage of the immune response relies on the presence of several micronutrients. I'm going to talk more about them. These micronutrients also have specific roles in the development and maintenance of our immune system. So you could see where it makes sense that if we're just eating enough, then our immune system is going to do what it needs to do and do its job. We do know that undernutrition will result in an impaired immune response. So the extent of that impairment depends on the severity of the nutrient deficiency or nutrient deficiencies, right? If there's more than one happening, that certainly is going to create more, it's going to accumulate in terms of the effect on impairing our immune system. So the micronutrients with the best known immune function responsibilities, some of these you might be familiar with if I were to quiz you and ask you, but maybe some of them you don't. So our vitamins include vitamin A, B6, B12, C, D, E, and K, as well as folate, that's another B vitamin, and then minerals, so copper, iodine, iron, magnesium, selenium, and zinc. So again, some of them may kind of stand out and you're like, oh yeah, I've heard that's good for boosting our immune system. Well, I'm going to talk more about that. And then there's some other compounds. Some are nutrients, some are not. Glutamine is a type of amino acid. And then also N-acetylcysteine, omega-3 fatty acids, and probiotics. They're also implicated in supporting our immune function. Now, as a society, we tend to not eat the recommended amounts of vitamin D, as well as magnesium, that's according to some reports, as well as omega-3 fats. So just calling those out as deserving of maybe some attention, potentially, right? So maybe we're eating plenty vitamin C and we don't need to worry about that, for example. However, what we see from surveys time and time again, it seems like these shortfall nutrients, vitamin D, magnesium, and omega-3 fats, they kind of come up often as ones that we're not eating enough of and potentially have a deficiency in. And a deficiency is where there's a problem with our immune function. It might make sense to evaluate further and determine if you're eating enough things, right, enough of these micronutrients, right? Is if you're restricted. So if you eat a restricted diet, maybe you're on an elimination diet for some reason. Maybe you're vegan, right? So you cut out entire food groups. It might make sense to just meet with a dietitian and confirm that you are satisfying your requirements. And it just means eating enough of these micronutrients. There's another example when you are under cancer treatment, potentially. Maybe you're not eating well, or you have some other medical conditions on board. If you're critically ill, certainly a lot of the research is focusing on supporting immune function during a critical illness. That's when you probably want a dietitian on your team and to help make sure that you're satisfying your needs and requirements. How else do food and nutrition matter? Well, there's a couple ways. So the majority of our immune cells are found in something called the GALT. I love that word, the GALT, and you can use it now, right? At your next social function, you could talk about this. So GALT stands for gut-associated lymphoid tissue. And what we know about supporting the GALT is that a high fiber plant-based diet supports the growth and maintenance of beneficial microbes that live in our gut. And it also limits the chance for inflammation happening within the gut. So good to know. It seems like that's the type of approach to take. And I'm going to talk more about that during the presentation. The other thing is that something called chronic systemic inflammation. We know that this can impair our immune function. It's key. It's key underlying factor of several chronic diseases such as cardiovascular disease, rheumatoid arthritis, and even some cancer types. So you probably have heard of inflammation. We've done Ask the Dietitians on inflammation. We sort of know we don't want chronic inflammation. We want to lower that systemic chronic inflammatory response if we can help it. Now, here's what we know, that if we have quote unquote characteristic obesity, and that's based on a couple parameters, which are debatable, to be quite honest. But if we have excessive amounts of abdominal fat, and that may sit especially around our waistline and surround our organs, so that's called visceral fat. It's not the subcutaneous fat of pinching an inch, right, like on our arms or legs, but it's that deep belly fat. That leads to some metabolic dysfunction. And what can happen is that can also be linked with chronic inflammation. So that's sort of the other angle here, right? So we talked about all those micronutrients, the vitamins and the minerals, but also too, it seems like we want to keep inflammation down as well. And we also want to support our gut. Our standard American diet is linked with the risk for gaining that excessive belly fat and then also with inflammation. Okay, so you see there's a couple ways that we can help ourselves now, right? And really the best approach for you might be to combine all of them or focus on one area or another. So the next question was foods that increase immunity. So again, we just want to remember adequacy. And there's a great expression of like the Goldilocks effect, where having the right amount is what is going to work for us. Not too little, not too much, the right amount. And that's the key for our micronutrients, especially. So another little quiz question for my audience. True or false? Food and nutrition can increase or boost immunity. So this is technically false. You will see this everywhere, even on some trustworthy websites. They will still say you can boost your immunity this way. I don't think that's appropriate language. It's not really accurately describing what happens. When we make sure we're eating enough and satisfying our requirements for what our immune system needs, that's good enough. We don't need to go overboard. We don't need to supplement. We don't need to overconsume certain foods. We just need to make sure we're eating enough. That sometimes is a hard question to answer. Am I eating enough, right? And that's where working with a dietitian can essentially help. We do have a set requirement for a certain amount of micronutrients, and that is good enough to support proper immune response. A deficiency of a nutrient is problematic. Eating extra amounts does not necessarily increase our immunity. It could potentially be harmful. And that's especially the case typically with supplementation. So here's just some examples off the cuff. Supplementation with iron. If someone has adequate iron levels in their body, this has been shown to cause premature death of T cells. We want our T cells to be alive and thriving. They're an important part of our immune function, right? So good example where extra is not necessarily helpful. There's another example. High intakes of zinc over a long period of time can cause low blood levels of copper, and having a copper deficiency would impair our immune function. So we really want to be careful and just give a little pause and a little skepticism about a lot of these claims, especially with supplements, that they're going to boost our immune system. Okay, it's really just a matter of getting enough. So if you're concerned about eating enough, as I shared, you want to consider working with a dietitian. There might be some amazingly easy ways for you to optimize your nutrient intake. And I think everyone almost has a potential to do that. Dietitians can help reassure you that you're on the right track or identify areas for improvement. Supplements may not necessarily accommodate for a diet that's low in nutrients. A good example of that comes to my mind is vitamin E. So did you know that vitamin E exists in 8 different forms? So there's like, for example, beta tocopherol, alpha tocopherol, gamma tocopherol, and so on and so forth. And they all have their own distinct physiological properties. So typically, and I want you to look at this, look at your supplements, even if it's a multi, or look at a food that is fortified with vitamin E potentially. it probably has alpha tocopherol in it. That's the most commonly supplemented version of vitamin E, yet we're not getting those other 7 forms that we need, right? So we want to remember that as it relates to eating a varied, healthful diet and not necessarily relying on a supplement. So now I've introduced some images of some local options, especially the citrus on the bottom right. So how do we eat in a way that supports our immune function? Overall, a very general approach here, right? It's a whole food plant-based diet. So it's going to supply ample amounts of the micronutrients that are required to support requirements. So think of a whole food plant-based diet as one that's minimally processed, right? So it's not necessarily like a meat alternative, because that might be really processed, actually, right? Or, a plant-based chip or a plant-based dessert. We want to think the whole foods because that's where the bang for buck is in terms of nutrients. So we're trying to consume mostly whole and intact grains, mostly vegetables, fruits, beans, lentils, nuts, seeds, and we definitely want to tap into our herbs and spices. If we're eating this way, great. The next step is to try to think about a variety of foods, right? If you're like me, hopefully not, you might get stuck in a rut and eat the same foods every day. I think as it relates to supporting our immune function and then also optimizing cancer protection, we want to think variety because there's so many different choices that we can have in each of these groups of foods. Now, at the same time, we don't have to eat vegan, right? So sometimes people confuse a plant-based diet with a vegan diet, and that's not necessarily what the experts agree on. The consensus is that a plant-based diet means just eating a lot of plant foods while having smaller amounts, but not eliminating animal foods. So ones that will support our immune function, especially, are fermented dairy, fish for the omega-3 fats, poultry, meat, for those amino acids that are essential for our body too. And sometimes we find omega-3s in poultry and meat as well. All right, next question. So best way to boost immunity while entering treatment without interfering with medications. Really great questions here. I get asked that one a lot where I work in clinic. Now, reminder, there is no way to boost our immunity, right? So the best advice, especially during treatment, is to practice universal precautions. So you're probably hearing this from your care team. You're going to really wash your hands well. So 20 seconds. You might sing happy birthday to yourself. I think that's the same time frame. Practice good judgment when you're in social settings. If there is anyone with a contagious, illness, you probably want to avoid that setting. And then food safety recommendations. If you have a reduced appetite or you're losing weight, absolutely ask for a referral to a dietitian or work with me here. Because if you are not eating well and you're losing weight, you might not be eating enough, right? And then there is the problem where someone not eating enough might develop a deficiency, especially of a micronutrient. So we might want to test that and see if an intervention needs to be determined. Consider what experts recommend for the healthiest ways to eat. Lots and lots of minimally processed plant foods. I just discussed that. And then a variety of choices rather than getting stuck in a rut like me, and then smaller amounts of animal foods. And that's really the best bet for someone who's on active treatment. Eating that way is ideal. And then trying to maintain their weight, not losing too much weight or also not gaining too much weight. So ideally trying to eat in this way. So I just took this little clip actually from Memorial Sloan Kettering. I didn't give them any credit, but I think they'll support our nonprofit here. But here's what we know, that a balanced diet is important for immune function. I'm integrative in my approach. And so very often I'll talk about how well someone's sleeping, how much they're moving their body, are they hydrated? If we integrate all of these variables, now we're really optimizing our approach in terms of helping to support our immune cell or cell function. Vitamin supplements are no substitute for healthy foods, but may be needed, right? So hopefully you hear that from me loud and clear. Sometimes there's exceptions to the rule. Ideally, however, we want to make sure we're eating a varied whole food plant-based diet. Now, some experts, and I really like this, they suggest replacing the thought of boosting our immunity with building a healthy body. And I really like that. And I really like that for treatment. Because the idea here is that if we're building a healthy body, then the treatment's going to work better. And we're going to feel better during treatment. And that for me would be my goal for the people that I'm working with. Nutrition is sort of like a tool. It's an advantage. It never replaces treatment, it can't even do what treatment does, right? But it can help treatment work better. And that's the goal for many people, all people that I work with. What anti-cancer drugs? With anti-cancer drugs, what should I eat to improve my immune health? So it's sort of similar to the last question, right? So during treatment, we recommend food safety precautions. It's sort of a myth that you need to avoid fresh fruit or fresh vegetables. A lot of times we just talk about the proper ways to prepare them so it minimizes the risk for foodborne illness. If your healthcare team recommends that you avoid those things, please listen to your healthcare provider rather than me. I don't know you as well as he or she does. And here's some other steps to follow as it relates to your food safety. So we want to wash our hands. That 20-second rule is a good rule of thumb. Warm soapy water, even lukewarm water, is great to help make that happen. Avoid food in bulk containers. I don't see them around as much as we used to. Obviously avoid the things that would be problematic. Spoiled food, unpasteurized milk, juices, and honey. We want to be careful of those because they can harbor pathogens. Keep our kitchen surfaces, our sponges clean. Keep raw foods separate. Especially if it's animal foods, we want to keep them in the fridge. They have to be kept at the right temperature. We shouldn't really be thawing out on the counter. Wash and scrub produce under running water. That's all it takes. No fancy sprays or anything, just running and running water and scrubbing if it can be scrubbed, our produce. Cook foods to the proper temperature, store food properly, and then think about like dining out, right? So if you're dining out, is the food being handled in a way that's safe for you to consume? For the most part, it probably is, but if you're immunocompromised, you want to keep that in mind. And then tap water concerns. So if you have well water, it's probably being managed by the public health department. And you have access to that information, but every so often that sometimes, I don't think in our area, but sometimes there can be some concerns that some pathogens are in our tap water. All right, next question. How long does it take your immune system to fully recover from IV chemotherapy? How nutrition benefits our immune response after treatment? Great questions. So immune function after finishing chemo, I think it depends on a lot of things. The type of treatment that you had, who you are, like, maybe you weren't sleeping at all, and maybe you were losing weight or you weren't eating a varied diet. There's a lot of things that play into this. My understanding is smoking will cause a decrease in our immune response, kind of makes sense. And so that could mean that it would take longer for someone to kind of recover, so to speak. But in general, from what I hear in practice, is that it may take anywhere from a couple months up to a year. There's lots of different types. I know this question was specifically about IV chemo, but there's even, it could be someone had surgery before their chemo. So there's a lot of variables that play into this, but that's a good rule of thumb. Hopefully you can ask your oncologist that question too, because I think that's going to be your best answer. Similar to any point during the treatment continuum, nutrition can benefit our immune response, right? So wherever you are along the cancer treatment continuum, it's important to try to build that healthy body, right? And try to think about eating adequately, eating in a way that it's minimally processed and a lot of plant foods a lot of the time. Again, if you have a poor appetite, and this is even after treatment, if you have a poor appetite, you're kind of stuck in a rut, you're hardly eating different foods, you're eating maybe the same things, you've lost weight, maybe you have a surgery or another condition that causes you to digest food poorly, and maybe you're not absorbing your food well, I would absolutely recommend a referral to a dietitian just to troubleshoot and just investigate if there's other ways to really support you and help you recover from that treatment. Another great question here. How much red meat can I eat weekly with metastatic prostate cancer, and how does red meat and fried food affect my immune system? So we'll start with red meat. Here's what we know about red meat. Okay, and this is in regards to all of the evidence, not just one little news story or study that we saw here and there, but all the evidence suggests that eating red meat increases the risk for colorectal cancer, and the amount of evidence is probable. So pretty good amount of evidence there. So good to know if that's in our history or we're concerned about protecting ourselves from colorectal cancer. We probably want to limit red meat. The evidence suggesting that eating red meat increases the risk for cancers of the nasopharynx, lung, and pancreas is limited. So less evidence. There's some, but they're not as strong as the evidence for colorectal cancer. So good to know other cancers types are on that list. And maybe if we're concerned about them or have a history of one of them, we want to think about limiting red meat as well. There is no available evidence to determine if there's a link between fried food and cancer risk. We just don't know right now. Okay, so I can't answer that one. I wish I could, but that's my answer. So for processed meat, now we're just moving beyond. The evidence that eating processed meat increases the risk for colorectal cancer is convincing. So it's interesting, the language, right? It's like semantics. So probably if somebody has had colorectal cancer or concerned about that in their history or for risk reduction, probably the most important approach is to limit processed meat more than anything, right? Because that word convincing tells me we probably need to limit it. Now, what about other cancers for processed meat? So nasopharyngeal, esophagus, so squamous cancer of the esophagus, not adenocarcinoma of the esophagus, but that SCC is important. Lung, stomach, and pancreas, that's limited evidence. So again, not convincing, but limited. So, okay, probably makes sense to limit processed meat still, right? If we don't want to take that risk and we don't really miss it. The evidence that drinking and eating dairy increases the risk for prostate cancer is limited. I threw that in there, even though you didn't ask about it, because that's really what we know about, and there's other things to share too, but that's not what this presentation is about. But for prostate cancer, we do want to be concerned about eating and drinking too much dairy. We probably want to eat just enough, right? And if you're concerned about that, again, you can work with a dietitian to get that answered. The information about it in terms of the evidence is limited. Again, it's not convincing. So this is probably why your oncology team never told you this, because it's not really that much information that is suggesting so compellingly that you need to avoid it, right? We just find we don't want to overconsume it based on the data. More to the story about all of this. So if we eat grilled or charbroiled meat and fish, this can increase the risk for stomach cancer. Now, the level of evidence is limited. It's not convincing. So it's not like if we had something on the grill over the summer, we're going to worry, right? Because the data isn't that strong. It's limited. Sometimes that's where we get confused, because somebody on a website or on a blog or on social media, they may really take advantage and manipulate the language here. And they may not share that the evidence is only limited. And they may make it seem like we need to avoid these things altogether. That's very often what I do on my one-on-one consults, is I help someone understand what really does the data suggest and what does myself or the experts recommend for this person, for this very unique situation, right? It's very important to share that. Now, what about fried foods, red meat, and our immune function? So fried food contains higher levels of something called AGEs, or advanced glycation end products. They naturally occur. They're like these compounds that are a result of non-enzymatic reactions between like sugars and proteins in food. And so at very high temperatures, like fried foods, for example, they can naturally occur, and we would eat them, and then they might have an impact. And the way that they have an impact is in our gut, is what we think. So it might in fact affect the lining of our gut, and then lead to systemic inflammation. So if the lining of our gut is there for a reason, it's really meant to kind of defend, right? And like keep the things out of our body that aren't meant to be there and to pass through. So if that lining is ever compromised, then the immune system responds to that, because it's like, wait, there's some invaders, I don't want them here. So if that lining is consistently compromised because of something that has happened in our lifestyle or in our diet, potentially, this could eventually, over the course of time, because the immune system is really fired up in protection mode, right? And this could lead to inflammation, but now chronic inflammation, because it's never fully repaired and that lining is compromised. I will share this about red meat. It can absolutely have a place in a healthy diet. There's nutrients in it. And I'm going to talk about that in a moment. But excessive consumption of red and processed meat can also lead to high levels of something called TMO, or trimethylamine N oxide. And TMO has been linked with inflammation as well. So it seems like these AGEs and TMAO seem problematic for someone when we're eating a lot of red meat, a lot of processed meat, and not eating a lot of other really healthy stuff too at the same time, by the way. The link with TMAO, if you have ever heard of that, it's more closely linked. The evidence is stronger for cardiovascular disease risk. So for those individuals that I work with who maybe that is something that they're concerned about or in their medical history, we may talk a little bit more about that separately from their cancer. And so this is sort of an indirect impact here, right? So inflammation is related to cancer. So if we want to keep inflammation down, this is part of a comprehensive approach to do that. Okay. Lots of sharing I'm doing here. So to help kind of get to the back to answering this question, because I think it's a great question. I have metastatic prostate cancer. What about red meat and fried foods? So we want to think about, if we're worried about our immune function, there's something really to be said about balance and harmony. So all of the foods that we eat impact, and nutrients that we eat will impact our healthy body, can help us build a healthy body. It's not like red meat and fried foods alone are going to be problematic. We want to evaluate everything else we're doing, right? And if you're consuming mostly whole plant foods, there absolutely is room for red meat, and certainly for processed meat occasionally, and certainly for fried foods occasionally, right? Red meat contains micronutrients that we know are important for immune function. Great examples are B12, iron, zinc, selenium, and potentially some omega-3 fats, depending on how they were living their life. Consider consuming red meat in about 12 to 16 ounces of cooked red meat per week. So to answer that question very directly, that's your answer. So 12 to 16 ounces, that's sort of a lot if you ask me. It's not enough for some people I work with, but that affords us, a good amount, a couple servings a week. And so if you're eating in that way and then eating that whole food plant-based diet, I would say you should hopefully feel reassured and confident that you're doing the right thing. And I would say, think about building that healthy body. Eat a lot of different plant foods every day. And that's where we're going to get some balance and some harmony in addition to those other things. Next question. I have an overactive immune system prior to breast cancer and having difficulty with allergies and lymphedema now. What are some diet changes to help? Either adds or avoids. I love that. Very direct. All right. So an overactive immune system, I think in regards to allergies or any suspicious reasons to evaluate if you're having an allergic reaction or an intolerance, I would say address that, right, medically. I'm not the person to do that. So even intolerance and sensitivities, I would say first evaluate that to see if there is something medically that needs to be uncovered and if there's more help that needs to be done there. Some people I work with do that, and then they still want to pursue an elimination diet. So elimination diets are tricky and they can be problematic for people, or because they're not easy to do. And people feel kind of lost, and maybe they do something unintentionally to hurt themselves. Maybe they stay on an elimination diet too long. There's very set protocols to try to follow. I wouldn't do something that's not monitored by your medical team, right? So a dietitian usually can loop in your medical team and make sure that you're doing something like this in a very safe way. Now with lymphedema, for those of you who don't know what lymphedema is, it's chronic swelling that is either primary or secondary. It tends to affect women and around the times of hormonal changes. Secondary lymphedema is, I think, what this person is asking in the question. It results from surgery, infections, some cancer treatments, or damage to the lymphatic vessels or lymph nodes. There's a well-established treatment protocol, so I would be remiss if I didn't mention this before I talk about diet and nutrition, but we absolutely want to make sure we're tapping into the things we can do that will help with lymphedema related to cancer and cancer treatment. Skincare, manual lymphatic drainage, compression, and exercise. Check, 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 check. Make sure those are the things you're doing diligently, because there's convincing data that will help you. All right. Now, the less convincing data, meaning it's sort of building and we sort of think we know some things, that's what I'll share about diet and nutrition. I would say what's talked about the most is weight loss, and weight loss may help. And I think a plan that pursues weight loss, I think, needs to be smart. It needs to be sustainable. There's a group here we have at the center that can help you do that. So just ask or maybe work with your care team if you think that that's appropriate for you. Eating more MCTs or medium chain triglycerides and less LCTs may be helpful. Long chain triglycerides are absorbed lower in our gut, and they actually get transported throughout our body using the lymphatic system. Did you know that? So if we're eating a lot of LCTs, it's making our lymphatic system work harder, and maybe that's contributing to the lymphedema. We don't know. There's some very early research in this area, but interesting and compelling nonetheless. So LCTs, as it turns out, they're mostly in foods with animal fat, so butter, red meat, full fat dairy. So we don't know yet if it means like eliminating them altogether, but I would say if you can evaluate what you're doing now, and if you're eating a lot of those foods, then maybe that's one step in that direction to try to eat less of that. Now, MCTs are not really readily available. Some people supplement with them. Otherwise, they're found in some other foods. I don't think it's appropriate to give you that list. I would say it makes sense though to try to eat less of the LCTs. MCTs are absorbed higher up in our gut, and they don't require the lymphatic system for transport. So that's why there's some theory. That's the working theory behind this type of approach. We don't want to restrict fluids. I mentioned that because sometimes people are heard that with edema, especially, they should be restricting fluids. That's not the case with lymphedema. We also don't want to restrict protein. Similarly, sometimes they hear for some reason that they should restrict protein. And I don't know if that's just, outdated information or something that they found online, but we encourage adequate amounts of protein. So while you're thinking about eating protein, we also want to eat the protein from foods that maybe have less of the LCTs, right? Because we don't want to load up on red meat and full fat dairy, but maybe make that switch towards poultry, eggs, low fat dairy, and loin cuts of red meat. Those are going to be lower in our long chain triglycerides. A little bit more about lymphedema and diet. Try to limit salt and salty food. Aim to eat mostly anti-inflammatory foods. So that's our plant foods because there's lots of fiber, and fiber seems to be anti-inflammatory. Next on the list is omega-3s. They are also anti-inflammatory. So highest sources of omega-3s are salmon, walnuts, and flax seeds in the plant forms. Herbs and spices, great ways to also reduce inflammation in the body. Aim to eat foods that also support our immune function. What do you know? There's some overlap here. So the foods that would help with reducing inflammation also support our immune system, mostly plant foods. And this is why like a whole food plant-based diet is what we recommend. It seems like it's like the umbrella, like to cover all of us, no matter what we're dealing with. And then also eating enough of the immune supporting nutrients, right? In theory, eating during a short time frame during the day, this is being investigated. So the thought is like an intermittent fast where someone might close their eating window to eat only during 8 hours of the day and then having no food outside of those 8 hours during the day. I think they think that doing that, again, it just reduces the need for the lymphatic system to work, which is really fascinating, but a little too soon to tell. So stay tuned on that one. Next question, do vitamins and supplements really make a difference in immunity, or is just eating fruits and vegetables good enough? I love that someone asked this question. So the bottom line is that dietary supplements are intended to do just that, supplement the diet, right? A whole food plant-based diet will provide variety, especially will give us all the nutrients we need in the amounts that we need them and the form that we need them. Sometimes there's exceptions. I mentioned that earlier. Someone has a deficiency, they probably might need a supplement to make sure that's repleted. If you don't have a deficiency, though, increasing the intake of vitamins and minerals through dietary supplements, there's no good evidence that it helps prevent infections or help us recover from infections any faster. Data hasn't panned out. What do you know? So again, going back to those necessary vitamins and minerals, vitamin A, D, E, B6, B12, folate, vitamin C, and then those minerals, iron, magnesium, selenium, and zinc. What foods are high in these? So it's interesting. Some of our plant foods have overlap, right? So sweet potato, spinach is another good example. They have more than one of these. So when we're eating sweet potatoes and spinach, maybe like once a week, a couple times a week, that's something to maybe get stuck in a rut with because it just has everything. It's like, what doesn't it have, right? But then also salmon is great for those omega-3s, as I mentioned earlier. Almonds, chickpeas, romaine lettuce. Nutritional yeast is really high in those B vitamins. Red bell pepper happens to be our single best source of vitamin C, if you didn't know that. It gives us like 130% or something in a serving. Breakfast cereals, some of our breakfast cereals are great choices. They might be high fiber, might be unprocessed or minimally processed, and then also fortified with some of our nutrients. And then white beans, Brazil nuts happen to be very high in selenium. And then lentils. Remember that we tend to fall short on vitamin D, magnesium, and omega-3 fats. So vitamin D might be the one exception where maybe you get blood work tested to see if your levels are adequate and do you need a supplement to take or not. And then omega-3 fats are highest in something like salmon, and magnesium is typically found in whole grains, and then also some of our greens, like leafy greens, and then also our nuts and seeds. Also, in terms of supporting immune function, I also like to recommend mushrooms. They tend to have compounds that are unique in terms of reducing inflammation and exerting some influence on the gut and helping to support our beneficial microbes. Same goes with oats and seaweed. There seems to be some beneficial compounds that are special and unique to those foods that support our gut health. And in turn, because most of our immune system resides in our gut, that's going to have implications for systemic inflammation, lowering it, and then also supporting immune function. And then along the lines of gut health, you probably know this, but just to share fermented products, onion, garlic, dandelion greens, and sunchokes. Now, I know we're running close on time, but I'm going to try to get through these very quickly. So those of you who get the slides, you're going to read a little bit more about some of the botanicals. And what I was trying to do here was basically myth bust. So people ask me about elderberry, and you're going to get content to that to see does elderberry really pan out, right? So you're going to get that information for yourself separately. I love this question. What's an easy grab and go snack that's good for immune health? Have you seen sumo citrus? It's in season. I just had one yesterday. It's delicious. So these are just some examples. Again, you're going to get these slides to see for yourself. But the idea here is that I'm really offering the foods that we know to have those nutrients, the micronutrients, the vitamins and minerals, the probiotics, right? Those things, the spices like what's in golden milk, if you haven't heard, is turmeric. So there's a way to sort of really tap into all of those nutrients that we know to be beneficial for immune health and then also enjoy them. And these are easy. These are like 1 or 2 ingredients, right? Easy to grab and go, easy to prepare ahead of time and take with you. The sumo citrus is in season now. It's super clean, super easy to eat, right? It peels right off, just like those clementines or the cuties. It gives us 163% of the daily value of vitamin C that we need every day. So I don't know, maybe it's not a coincidence that it's in season right now. We need it, right? What about winter tips to get us through this season? Eat lots of fruits and veggies, right? So frozen options count too. I think in the summer, our diet tends to shift towards lighter options and more of our fruits and vegetables. Don't forget, we need them all year round, right? And even frozen options count. Try not to smoke if you can help it. Exercise regularly. I just met with someone this morning who isn't walking because the weather isn't allowing that person to walk, but they have an elliptical in their basement, so they're going to get on that elliptical every day. I do think it is important to try to get outside when you can, right? Make sure you're using some great breathing exercises. Get outdoors. That may also encourage you to be active as well when you get outside. Certainly manage stress. If you need ideas, work with Cancer Wellness Center because we got lots of ways to help you manage stress here. And then adequate rest is so important for immune function. Now, what about the influence of diet, exercise, and the microbiome? I wasn't really sure what this question was getting at, so I'm just going to share what I thought it was. So exercise, what doesn't it do for us? Right? So in terms of our immune support, it can help us when we're exercising, it helps us flush out bacteria, both out of our lungs and our airways, but then also to our gut, as it turns out, because we're probably going to the bathroom regularly. It causes changes in our antibodies and white blood cells. I did not know that. There's a brief rise in temperature may help the bacteria that thrives in different temperatures from growing. So that's actually helpful. I find that so fascinating. It does slow the release of stress hormones, right? So if that's a way of coping with stress, great. You're really tapping into all the benefits of exercise then. And then moderate amounts help, right? It doesn't need to be excessive. So 20 or 30-minute walk, going to the gym every other day, riding a bike a few times a week or a stationary bike, right? It may also increase the substrates for beneficial gut microbes, right? So there was a really interesting study, I don't have time to talk about it, but they looked at people and they did track their weight over time, but they found that when people were active, even if they didn't lose weight, it benefited their gut and their gut microbe population in beneficial ways. So it's in turn going to support their immune system, right? So even without losing the weight. So I share that because sometimes people exercise only to manage their weight. but there's so many other things it does. And the other things that they do are going to support our health, but probably in turn help us pursue the things we also might want to do to manage our weight. What about diet? Well, what doesn't diet do for our health? Just like exercise, right? A whole food plant-based diet is associated with improving gut microbe diversity, and this is beneficial for immune function. It provides substrates for our immune cells to support the integrity of the lining of our gut, which I talked about earlier. And it also results in the microbes, the beneficial microbes secreting metabolites that happen to modulate inflammation, which is way cool. So eating sources of probiotics like fermented dairy, and then also prebiotics like onion and garlic, this will help further support our gut function. I did a whole talk on prebiotics and probiotics, I think in November I did it. Okay, so about the microbiome, we still have a lot to learn about the impact of microbiome on our health and disease, but keep in mind too that we all have a unique microbiome, so it makes it very difficult for us to apply any kind of practical information in the clinic or with your doctor. We just don't know yet, so it's really just kind of a generalized approach. So eating a diverse diet emphasizes minimally processed plant foods is recommended for a lot of reasons. It's going to support our immune function, reduce inflammation, and it also happens to be beneficial for our gut health. You're going to get these slides too. So what this does is it lines up the different types of diets that we could eat in this particular study and the impact that it had in terms of the population of the microbes in our gut, and then the implications of that in terms of how it helps with potentially reducing inflammation or raising inflammation depending on the diet. Maybe I'll talk about this one in our next Ask the Dietitian. So just sharing some resources. Thank you for staying with me. We're almost done. The NIH has a great website specifically about dietary supplements, specifically for immune function. So if you're one of those people that's like, I want to take vitamin C, I want to take zinc, check out this link and it's going to show you what we know and what we don't know. It's not as fancy, shiny, compelling as you might think. And the research is kind of ho-hum, right? It makes you kind of feel like maybe you don't need to take those supplements. Another great links just that you'll follow towards trustworthy resources of information, like how to keep your immune system healthy with nutrition, and then optimal nutrition for a healthy immune system as well. Okay, so check those out. The recipes I want to share, there's a rice congee on the bottom left, which is really comforting. I was thinking of like all of the issues we have in terms of this time of year, and there's a GI bug that's sort of going around. So just in case you're curious about other things that maybe you can help yourself with, the rice congee is so gut friendly. It's so supportive for the gut. So if you're having a rough day, it's something to maybe tap into and rely on. Overnight oats, what do you know? That's going to be super gut friendly. And it includes carrots. So we're having vegetables for breakfast potentially, but also would make for a really good snack. And then some red lentils. Again, I was thinking of what are the micronutrients that we could eat more of in terms of supporting our immune function. So that's where these recipes fit in. Now in February, we're going to meet again for our Ask the Dietitian. It's going to be all about plant proteins. So hopefully you agree that's another good topic of choice. We're going to meet the first Friday in February and at our regularly scheduled time at 1 o'clock. So I'm going to stop my share here. And again, I thank you for staying on. I know we have like maybe a minute or two.